I, the juror Juan Zaragoza, thoroughly have examined the testimony, evidence, and rules of procedures presented in this courtroom for the case of Ashford Hospital versus the plaintiff. The patient is suing Ashford Hospital for the improper release of health information. After carefully examining the facts, I fully support the defendant. I also find the claim to be unsubstantiated. The complaint was not filed properly. As described by the U.S. Department of Health and Human Services, the plaintiff has a right to file a health information privacy and security complaint with the Office of Civil Rights if he or she feels that the hospital has violated her health information privacy rights. Which in this case, the plaintiff is suing Ashford Hospital for damages and is requesting policy changes. Although the plaintiff is an employee as well as a patient at Ashford Hospital, the allegations being filed by the plaintiff are solely based as a patient. The plaintiff expresses one of her main concerns to be related to her supervisor having the ability to distinguish her personal issues with her employment ability. Furthermore, the plaintiff fears that the providers will spread rumors to other employees that will affect personal relationships with coworkers. I find all these allegations to be based on opinion and not facts. In clinical context, the American Medical Association Declaration of Professionals Responsibility in 2001 vowed that we, the members of the world of community and physicians, solemnly commit ourselves to protecting the privacy and confidentiality of those whom we care, and breach staff confidence only when keeping it would seriously threaten their lives and the safety of others, as noted in Bustillo's Section 5.1. Hospitals and healthcare staff are professionals as described in the clinical context. Given that the plaintiff did not provide any evidence, providers act in the best interest of the patient. There is no evidence that there was a malicious intent to disseminate patient information as stated by the defendant. Hospitals must comply with HIPAA regulations. The senior administrator has the right to access patient information, as some of the duties that an administrator must perform require patient information such as billing, coordinating medical treatment, and follow-on care. It is not uncommon for the OR to have received the PHI on the patient. Providing the staff in the OR with patient personal information assisted the staff in preparing for surgery as stated by the defendant. In summary, all the allegations stated by the plaintiff were filed as a patient. Given that the plaintiff elected Ashford as her primary health care provider, the patient should understand the policies and procedures. The employment-based concerns were all based on assumptions made by the patient and unfounded. The defendant acted within his scope of practice, and evidence provided does not support HIPAA violations.